Hi, everyone. If you're just joining us, we're going to get started in just a minute here. And we got a quick poll up to see where folks are coming from, if you've been with us before, and skills you might have in the area of development. All right, good afternoon, everybody. We're so happy to have you with us today for our fourth webinar on our series in creating housing opportunities for people with behavioral health needs leaving jails and prisons. We're going to get started right on time today because we have a very packed and exciting agenda for you. And just to note, as always, this meeting is being cross-checked. So my name is Charlie Francis. I am a project manager with the Council of State Governments Justice Center, and I will be your host today. We have a little poll open that I will leave open for another minute or two while we do our introductions, just to kind of see where everybody's coming from, if you've been with us on these webinars before, and kind of what your skills might be in the area of development. So we'll keep that open for another minute or two as we do our introductions. Next slide, please. So this webinar and the whole series is made possible by the generous support of the California Healthcare Foundation. So we appreciate them continuing to support us and helping to really put out strategies and best practices to help people of low income to connect with healthcare options, and particularly folks with justice involvement, which is a real population of interest to all of us. So we thank them for their support. Next slide. And we are the Council of State Governments Justice Center, a national, nonprofit, nonpartisan organization that's a hybrid between a membership association representing all branches of state government and a think tank with policy and research expertise to develop strategies to increase public safety and strengthen communities. So we're very happy to be with you here today. Next slide, please. So today's agenda, we have a lot to talk about. After we go through our introductions, we're going to have a quick introduction from our partners at the Council on Criminal Justice and Behavioral Health. We're going to give you some context, as we always do, from our California Housing Report, focused on our recommendations for what local leaders can do to help expand housing supply in their community. And so we're going to use that to set a bit of context and do a quick review of key housing types and concepts, just to make sure that we're all speaking the same language. And then we're going to get right to our presenters. We have two guests with us today from Building Opportunities for Self-Sufficiency, BOSS, in Alameda County, who are going to share with us some of their past and present work around creating housing for people in reentry. So we're really happy to have them with us today and excited that I know I'm going to learn a lot. And then after we hear from them and have some time for Q&A, we're going to get back more into sort of some of the technical stuff, some more strategies on funding housing and some of the key federal and state opportunities that are out there right now, some strategies for engaging with development partners in your community and gaining community support for development efforts, and then a quick word on resources and next steps. But before we get to that, I'm going to close the poll. We've had 55 folks participate so far, which is great. And so where is everybody from? Looks like we have a pretty even distribution from around the state, a particularly large number of folks from Superior, California, Butte, Colusa, El Dorado, and other counties up that way. A lot of folks from other areas of the state as well too. Substantial amount of folks from San Francisco Bay and the Inland Empire and LA. So really got a whole statewide representation with us today, which is great. Let's see. And the next question, looks like we have over a third of folks here who this is their first webinar in the series. So welcome, we're so glad you're with us today. And then we have a pretty even split of other folks who've been with us for 1, 2, or 3 other webinars. So we're really glad that you're back with us. And we hope that you get a lot out of today's session. And then finally, our fun little silly question: what personal skill do you have around housing development? If you came in early, you heard me mention that one personal skill that I do not have is being handy. You do not even want to let me swing a hammer, let alone oversee any kind of construction project. But it sounds like at least a few of you out there have a trade skill related to housing construction. But like me, many of you are really good at bringing people together or advocating or educating the people around you about housing development. That's really great because that is going to be a huge thrust of what we're talking about today. So thanks for sharing those a little bit more insight about yourself and where you're coming from. And if you can go to the next slide, I'm going to pass it over to Brenda Greylish from the Council on Criminal Justice and Behavioral Health to give us a quick word of introduction.
Yes, thank you so much, Charlie, and welcome everybody. It's so great to see so many folks joining, and even around our state and our country. It's just wonderful to have you all here taking an interest and having this passion to really serve the population of individuals who are involved in the justice system and have behavioral health needs. We've been really excited here at the Council on Criminal Justice and Behavioral Health to partner with the Council on State Governments Justice Center on this project and several other related projects over the last couple of years. And I know I've learned so much and continue to learn so much. And I know there's a lot of work, a lot of investments being made, particularly here in California. There's significant investments being made in both our healthcare systems, behavioral health, as well as to address housing and homelessness issues across the state. So just real quick note, we've had already as part of this series some focus on collaborating and knowing your collaborative partners and doing the assessments, screenings and assessments. And really, when it comes down to it, we can do all of those things, but if we don't have the housing, we just can't actually get folks connected to safe places where they can live and receive all of the healthcare and behavioral health treatments that they need to survive and thrive in our communities. So really important webinar today, and so glad all of you can join us. I'll go ahead and pass it over to Charlie so we can get started. Thank you.
Thanks so much, Brenda. Next slide, please. Oh, okay. So yeah, as you can see, this is our 4th out of our 5th webinar focused on development today. And so we hope you'll stick with us in addition today, as well as for our last session, where we're going to focus more on rental assistance and supportive services. We not only need to create more units, but we also need to have the financial support to help make those units affordable to people, to keep operating those units, and the supportive services to help people connect to housing and stay housed. Next slide. So a little bit of context on the relevant recommendations from our California Housing Report. And we'll go to the next slide again. So California is in the midst of a long-standing affordable housing crisis. It's definitely not unique to California. This is definitely something that we're seeing in most places around the country, but it's hitting California particularly hard. There's only enough affordable housing for 2 in 10 extremely low-income renters. And when I say extremely low income, what I mean is somebody whose income is at or below 30% of the median income for a given area. And what I mean when I say affordable is that people, the general standard for affordability is that people are paying 30% of less of their income towards housing costs. So it's tough out there for everyone, and especially people who've been involved with the justice system, which I'll get into a bit more in a bit. Put another way, to meet this need, California needs at least 1 million more affordable units for extremely low-income renters. That's a lot of units, and I'm so glad that you're here today and want to be part of the conversation about how we can move the needle and create more of that supply. Put yet another way, 3 in 4 California renters who are eligible for federal rental assistance So the Housing Choice Voucher Section 8 program, as well as public housing and other subsidized programs, don't actually receive it. So, that is why you always hear about, particularly with housing authorities, but other subsidized housing programs as well, having years-long waiting lists, because there's just not enough out there to meet the need. Next slide. And so if you've read our housing report, you know that the whole first section goes into a range of different barriers faced by people with behavioral health needs coming out of prisons and jails, connecting with housing. I don't think I need to tell anybody on this call that there are a lot of silos between the criminal justice, housing, and behavioral health systems. We don't always talk well to each other or have mechanisms for communication. We've also talked on past webinars how we all know that people who are leaving prisons and jails are at an elevated risk of homelessness, and finding housing is challenging, but we still don't have a whole lot of granular data on that, particularly at the local level. But today we really want to focus on these other three key challenges. As I just stated, supply of affordable housing in California is critically low, but people who are leaving prisons and jails, they face even more difficulty in accessing the little housing that is available, and that's for a few key reasons. Part of it is just stigma, among housing providers and landlords serving this population. There are regulatory barriers, in particular, HUD's definition of homelessness, while it accomplishes an important goal of prioritizing people who have been homeless for a long time, what we call chronically homeless, it makes it difficult to prioritize people who've been in prison or jail, particularly for a long time. And many housing providers too, even if folks are not facing outright stigma, there are still many cases where a housing authority or privately owned multifamily housing development might have a very broad look back policy. So say, if someone had committed a felony maybe 5, 10, 15 years ago, they may still be disqualified from that housing, or they may be disqualified for certain minor offenses. So there are a lot of barriers out there, which makes it really important for us to not only increase the supply of housing, but as we increase the supply of housing, we need to make it available and accessible to the folks that we serve. Next slide. And so from our report, the recommendations that we're really focusing on today fall into two buckets: increasing resources to immediate housing needs. So you get somebody into housing, how are they able to pay the rent immediately? We're going to focus on that a little bit less today, more in webinar 5, but really touch more on developing new affordable housing supply statewide as a way to move the needle long term. Next slide. And so what does this mean for folks at the local level? Well, we definitely want to increase rental assistance, through a variety of means, including local rental assistance, such as diversion program funding or shallow subsidies, maybe from a sheriff's department or a local health agency, and also partnering with philanthropy to expand resources for rental assistance, as a number of California cities and counties have done locally through a model called flexible subsidy pools. That's something we're going to get into in more detail in the next webinar, but for now, just know that that's a really promising model where locally the philanthropy will sort of seed an investment, philanthropy or another partner will seed the investment, and philanthropy and government will sort of put in those resources together to increase the amount of rental assistance available, and then complement it with supportive services to connect people to housing. But then in addition to that, we need to be building partnerships with public housing authorities to set aside units for people who are leaving prisons and jails. We got to partner with landlords, in particular by creating more incentives to be able to rent to the folks that we serve, and also preserving the inventory that we already have, particularly board and care facilities, which are really sometimes underappreciated resource in the state. Next slide. And the things that we're really going to be focusing on today are making sustained investments to increase supply. So some of the strategy types that we're going to touch on, most of them revolve around building partnerships, because we have people on this call from criminal justice agencies, we have people from behavioral health agencies, we have people from other community partners. We may sit in all sorts of different places in the community, and we may not be the ones who are actually building the housing ourselves, but we want to get to the table with the folks who are, and really advocate for housing to be built and advocate for folks who are leaving the justice system to be prioritized for that housing. So partnering with local governments, partnering with housing providers, partnering with developers, depending on the funding stream, it really varies, who controls the purse strings. But the funding sources that we're really looking at today are first and foremost the American Rescue Plan Act, once in a generation federal investment in housing, as well as, also the landmark state investments that have come, particularly with the budget last year, around programs like Project Home Key, which we'll get into in a bit more detail later on. In addition to that sort of central strategy, we want to be thinking about how we can use those funds to leverage other more traditional housing funding sources like low-income housing tax credits, for example. And then what other resources can we bring to bear to help development efforts? Surplus land is a big one in particular, and I know California has some legislation around being able to repurpose that for housing development. And then more creative methods, are we saving money in corrections in the long term, for example? And can we look at redirecting any of that money towards gap financing for housing development? So really, this is a tough issue. If it wasn't tough, we would have solved it by now. And the point I really want to drive home is that we have to be looking at a whole range of strategies around partnerships and creative funding to really make a difference here. Next slide. So just a couple more primer slides before I get to our special guests on key housing types and concepts. So on the next slide, what you'll see is we're really going to be talking about permanent housing today. When I say permanent housing, I mean housing that is without time limits. So we're not talking about emergency shelter. We're not talking about transitional housing. In many cases, we're not talking about recovery housing either. All of those housing types are very important and necessary, in creating housing options for people who are transitioning back to the community. But today we're really talking about housing that has no time limits and that is affordable in perpetuity. So a real key type, which you may have heard of before, is permanent supportive housing. So that's affordable housing without time limits, but where services are provided either on site or in close connection with the housing itself, what we call wraparound services. So that might be case management, it might be supported employment, it may be connections with treatment. It's really a whole range of things. And that is housing, it's expensive. So it really should be targeted towards people with the highest housing and behavioral health needs, who are coming out of incarceration. We also have what's called rapid rehousing, which is a temporary intervention to get people into permanent housing. So it's people who might need a lighter touch, maybe some short-term financial assistance and services to connect to housing, because one of the biggest barriers is housing search. So rapid rehousing helps people find housing, helps sort of meet the immediate barriers, might be moving costs, short-term rental assistance, and provide services to keep people housed. But then other affordable housing, PSH is really important for a certain subset of the population, but many, many other folks just need housing that is affordable over the long term. It may come with some level of supportive services, but that's not usually the focus. So that's when we think of the more traditional or well-known affordable housing, such as vouchers or public housing. Next slide. And just a little slide here on myth busting. I think what we all hear, what we all talk about a lot of the time is how there's just never any money for housing. And while it's true that, even with huge federal and state investments that we're seeing right now, it's still not enough to solve the problem. The reality is we have more money to play with now than we have in decades. And so our job is really to know who controls that money and how to use it most efficiently and effectively for people leaving the justice system. It's really a once in a century funding level, many, many billions of dollars under the American Rescue Plan, plus 12 billion from the state. And the state is also really making note of the fact right now that the local approval process is often a barrier that keeps housing from getting built. So there was, a number of legislative pieces that passed last year around making zoning easier on the local level and just giving more flexibility in terms of the housing that can be permitted. So, there's never enough money for housing, but there is money for housing. Next slide, please. And so finally, before we get to the next portion of our webinar, just so you understand, when we talk about funding housing, we're actually talking about a few different things. We're talking about capital. So that's exactly what it sounds like. It's the cost to actually build or rehab the housing. We're also talking about operating funding, which is often the trickiest thing to come by, because you can build housing, but you need to be able to operate it over the long term and keep it affordable to people with lower incomes. So that's what operating funding is. It's quite literally keeping the lights on. It's subsidies to cover the gap between what it costs to operate the unit and what people can actually pay. So that is something we'll come back to a few times on this webinar and on webinar 5 as well. And of course, services, case management, mental health services, connections to housing, et cetera. Really, to be able to serve people with behavioral health needs and housing projects, you need to be able to find funding for all 3 of these sources. Next slide. Oh, I forgot I had one more. In terms of when we're talking about developing housing too, it can be in different configurations. We have what's called scattered site housing. So which typically means that you may attach rental assistance to apartments that are in a range of different locations across a city or a county or a region. Or you may have single site housing, which is what people typically think of when they think of a housing project or development, so exclusively dedicated to people who need affordable or supportive housing. And you may also have an integrated model, so one housing developed, but maybe some of the units are subsidized or supportive housing and others are not, really a particularly popular and successful approach to help people be more integrated into the larger community. Next slide. All right, so enough from me for now. It's my great pleasure now to introduce, we have a couple guests with us today from Building Opportunities for Self-Sufficiency at BOSS in Oakland, California. An agency who's been doing this work for many years, many decades. Their mission is to help homeless, poor, and disabled people achieve health and self-sufficiency and to fight against the root causes of poverty and homelessness. They're doing a whole range of work in this space, but today they're really going to share with us all the efforts that they've been making over the years and plan to make in the future around creating more housing for people in reentry. So with us today, we have Donald Fraser, the Executive Director, and Amita Singh, the Deputy Director, who are going to be sharing with us about their experiences in developing reentry housing, some of their lessons learned, and hopefully we'll have time for a few questions as well, too. So without further ado, I'll pass it over to our guests.
Good afternoon, everybody, and thank you so much, Charles, for the introduction. Again, my name is Donald Fraser. I'm the Executive Director with BOSS, Building Opportunities for Self-Sufficiency. Amita, if you want to introduce yourself real quick before I lean into the presentation.
Sounds good. Good afternoon, everyone. Welcome. My name is Amita Singh, and I'm the Deputy Director for Clinical and Criminal Justice Programs at BOSS, and very excited to be here. Thank you.
Fantastic. So, and thank you again, Charles, for identifying our mission. And so, BOSS was created in 1971 in Berkeley. So we turned 50 years old last year in the middle of a pandemic, mind you. Couldn't have our anniversary, but we're planning on it next year. So yeah, we were created in 1971 to help individuals with severe and persistent mental illness who had become displaced because of public hospital closures. And so our programs and services expanded over those past 5 decades to include services for unhoused, disabled, and low-income individuals, families in neighborhoods in Alameda County. And I came on board after the former executive director retired in 2013, January of 2013, actually. And I got the leadership team together and we expanded our mission and began developing solutions to mass incarceration, mass homelessness, and community violence. And the idea was to start addressing some of these crises that stem from racially based policies and systemic inequalities, inequities. And so that's kind of the thrust of where we were. And so we came together and started putting our minds together on primarily the reentry population, the folks who are coming home, certainly folks who are still incarcerated, and how do we create a pathway or ramp for them to safely land with resources. And then the violence that's happening in the community, especially in Oakland, which is over the top. So we're primarily based in Alameda County. And our footprint, our geographical footprint in the cities, we're in Berkeley, Oakland, Hayward, and San Leandro, and some of the unincorporated areas as well. So I want to start, after that brief background, I want to start with a partnership or kind of a process in terms of how we do what we do, and I'll aim this specifically around the housing that was developed when I got there, and then housing that's being developed or was developed when I got there in 2013, and then housing that's being developed as we speak right now. So again, I want to talk about partnership being the key, and Charles kind of pointed that out. And I'll begin with some of our partners, certainly at the state level, the State of California Board of State and Community Corrections, in Alameda County, certainly our Board of Supervisors, Healthcare Services Agency in Alameda County, including the Office of Homeless Care Coordination, Alameda County Probation Department, the cities of Oakland and city of Berkeley, tremendous partners in terms of helping us get these particular projects funded. And of course, the Alameda County Housing Authority and the Oakland Housing Authority as well. And obviously, their participation in that is the vouchers or the subsidies. So I want to talk about some of the projects that we have, right? And we have permanent supportive housing projects in Berkeley, Oakland, again, Hayward and San Leandro. And we have, I won't kind of lean into the transitional housing that we have right now, because Charles wants to mention that we need to talk about permanent housing, but I do want to say this. It's easier to develop transitional housing for reentry populations where we can dedicate that building for reentry populations as opposed to permanent supportive housing. And I'll tell you why in a minute, but we're still doing it, but I'll tell you the complications and some of the barriers related to that. So we do have a men's facility and a women and children's facility, the first of its kind in Alameda County, where when people are released, they come and it's an 18-month process, right? Again, it's transitional. And then our housing navigators then connect them with permanent housing. And there's a tremendous amount of service delivery happening at those sites as well. And Amina could talk about that in a second. But we're partnering again with Panoramic Interest and the city of Berkeley. So Measure P, that was a local measure that was passed in Berkeley, primarily for housing. And so with Measure P funds, with Alameda County Healthcare Services Agency, and then Panoramic Interest as a developer, we're erecting 39 units in the city of Berkeley. And then on 7th and Campbell, in partnership with Elaine Brown, who's the Chief Executive Officer of Oakland in the World, also former chairman of Black Panthers. She would not forgive me if I did mention that. And the developer there is McCormick Barron Salazar. And that's going to be a 79-unit permanent supportive housing project in the city of Oakland. So I think one of the key issues for us, right, certainly, and in terms of building the partnerships, and we're fairly good at that, right, and really having creating this public-private partnership, And sometimes there are private developers that come in that help us. Sometimes there's nonprofit developers that come in to help us on the development side. And then we're really good at approaching government entities for the supportive services dollars. The challenge is, and I think will always be until we change it, the affordability concept of those units, right? Because all of the units, certainly we try to get them subsidized, right? And do a project-based Section 8 or have some kind of subsidy attached to the unit. But the subsidies are, we run into a problem, a wall all the time. There's only a certain percentage of subsidies that they would grant to the project, like the 7th and Campbell project. Luckily, we were able to get all of the units subsidized with our Step Up Supportive Housing project in Berkeley. But that's problematic, right? I'll say if we fight for anything, let's fight for universal subsidies for everyone. And in the region of the world that we live in the Bay Area, it is extremely expensive, housing extremely expensive. And landlords, even though we had a local ordinance passed around fair housing, specifically for justice-involved individuals, where ideally a landlord can't discriminate against an individual because of their criminal background. But that was a plus. But the question always is it actually working, right? Is it living up to its intent? I do want to talk a little bit about the Step Up Supportive Housing, because not only did we get City of Berkeley and the Measure P funds and Healthcare Services Agency, Kaiser also came in as a funding partner as well. So that financing was very rounded out with philanthropy, government, and the measure through Measure P. And that was a very solid project. I'm extremely happy about that. And we're breaking ground in April at 1367 University Avenue in Berkeley. If any of you want to come to the celebration, I'll send the invite. But I think I want to stop there. I think if there's any, I think that I missed, I think, I will say this, that one of the important pieces in the whole puzzle with housing, right? And we, with these particular projects that we've created and all of the permanent supportive housing that we created, I think the services piece is extremely important because of the complex nature of individuals that live in the spaces. And again, we started out as an agency, again, in 1971, with our population was individuals with severe and persistent mental illness. And that was a response at the time, again, to the closure of the public hospitals, right? And so we've kind of maintained that, right? So all of our permanent supportive housing targets that population. And we opened up a transitional age youth permanent supportive housing project in Hayward as well. And again, individuals with severe and persistent mental illness, the most vulnerable in the community. But Amita, if you want to talk about a little bit about the services side in terms of what we're seeing and processes that we're putting in place to assist the population we serve.
Absolutely. Thanks, Donald. So I can speak on the reentry side in terms of the housing that we have, the transitional housing that we have for folks that have been involved with the criminal legal system. So as Donald mentioned, the Women and Children's Campus is the first of its kind in Alameda County. So it's a 21-bed facility that has 7 apartments, and there's like a shared accommodation situation, and the women get to develop the skills that they need to be able to live independently. They receive support around housing, employment. We run a variety of different groups on site to support around everything from addressing substance use to healthy lifestyles, to being able to pull together the documentation that you often need, whether it's your identification documents and whatnot, in order to be able to apply for housing and jobs and those kinds of things. So there's a variety of different services that happen both in the women's house and then similarly in the men's house. In terms of the challenges, I really appreciated what you said earlier, Charles, about the silos that happen, because it's not as if somebody who's in the whose system is impacted doesn't also have mental health challenges or needs that need to be addressed, or maybe some substance use challenges. Certainly trauma, right? And how trauma shows up is a large part of the services that we provide in terms of helping people to address that, to try to stabilize, to try to heal. And so in the Bay Area, our behavioral health services were already under strain prior to the pandemic. And what I've witnessed is just that system has broken, right? So now you have folks in the last couple of years with COVID, the amount of stress that has placed on people's mental health, physical health, and emotional health means that there are more people that are seeking mental health services. Folks that might already have been vulnerable are really, we're having a higher level of acuity, so that folks are showing up and are really needing strong mental health support. And those services are just underwater. They're just overwhelmed. And so what we're dealing with is now people want to resort back to the criminal justice system as being like one of the only options available to address getting mental health care. And that's not sustainable, obviously. So I know in Alameda County, we've just set up a task force to look at that, to try to limit the use of the criminal justice system as a way to get people the support that they need. So I'm very excited to be part of that task force to see if we can create some innovative and creative solutions. But certainly mental health needs is big. The affordability of housing is huge, or the lack of affordable housing. And then also substance use treatment, right? So folks have definitely been struggling with addiction. And when you talk about trauma and when you talk about the amount of grief and loss that folks that are involved in different systems are having to navigate, then that's what's coming out on the housing side. And that's what staff are having to deal with. And so that's what agencies are having to deal with. And then we have, in addition, staffing issues and the turnover of staffing and the lack of staffing. So you can see that there's a lot of challenges that do arise when we're looking to work in this area. And I like to think that we're creative in addressing some of those challenges and doing what we can. And I'm definitely very excited about the Women's and Children's program, because I'm hoping that will be replicated. I think there is a wonderful opportunity there to really intervene when you're talking about young children, to intervene in the trauma that happens with homelessness, that happens when you have parents that are involved in the criminal justice system, and maybe you don't have access to your mom or your dad as a result, and the trauma that comes from that. So to be able to have a space where women can come together in a safe space, to be able to be either reunited or to be able to be with their children, and then to get stable is just a huge, huge opportunity. And I'm very excited that we get to be part of that.
Yeah.
Is there anything else I've left out, Donald?
No, that was great. I mean, and then from the transitional housing to really transition into permanent supportive housing, we identified a 36 3-bedroom and 6 2-bedroom property on San Pablo in Oakland that we're hopeful. And one of the challenges, and there's multiple projects that are on the table, but I think to address the housing issue, specifically for criminal justice involved populations, like in Alameda County, we have a coordinated entry system, and I'm sure that that's most likely in every county. But one of the issues are we're not the gatekeeper. So as they prioritize the population, let me back up and say, if we're getting county funding through Healthcare Services Agency primarily for the services, we have to utilize the coordinated entry list. So the coordinated entry referrals, again, we're not the gatekeeper, and as they prioritize based on need and high acuity, and then they make the referral or the match to the specific unit. And so, as I said earlier, in terms of having a dedicated facility exclusively for criminal justice populations, it will be a stretch, especially if we're using county government funding as part of the financing of the services and or the building, the property. So I wanted to kind of put that out there as well, that it's not in terms of permanent housing for justice involved populations. It's not as easy, at least in our county, to have that dedicated unit as it may seem. So I want to stop there unless maybe leave some room for questions or comments. Charles.
Oh, that sounds great. Thank you both so much. So I definitely have a couple of questions that I'd like to pose, but in the meantime, I'm sure you all have plenty of questions of your own. If you want to either raise your hand or put them in the chat, we'll make sure to get those to our presenters. But in the meantime, one thing I really wanted to ask about is, so much of housing comes down to funding. And what really piqued my interest was hearing that you had Kaiser come to the table, Kaiser, the health plan, come to the table and bring some funding for housing. One point that we're going to drive home in a little bit is that to really make a difference here, we really need to get everybody to the table and go beyond sort of the usual funding suspects. What are sort of some of the early steps that you had to take, though, to get that buy-in and build those partnerships? Because that funding just doesn't come out of nowhere or come quickly. What did you have to do to get there?
Yeah, I mean, actively building those partnerships, doing a little bit of research in terms of who's involved with what and what folks are doing, especially Kaiser. And Kaiser, in the city of Oakland and the Bay Area, was very involved with housing. And so we kind of sifted through the Rolodex until we found the right person to start having those conversations. And the conversations were extremely descriptive and very, very real. I mean, in terms of what the need is, what the problem is. And it took a while, granted, but that partnership is very strong now, and they came in with financing for that, for our step up supportive housing. And it's a modular build. I think the uniqueness of this particular project was really interesting to them. So it's modular housing. We can put it up in 6 to 9 months. And the quickness of it, the efficiency of it really was interesting to them as well. But yeah, building that partnership, it took a little bit of time, but we had to search, do some research, and make the connection and keep on massaging it. And until present day even, and we're continuing that relationship.
Just piggybacking on that, other communities who may really see a need for reentry housing and want to build these sort of partnerships, but not know where to start or even who to talk to, what are some first steps they could take?
Well, I would say if you're speaking to Kaiser or any corporate or foundation entity, they all have a, and I'm losing the name of the department that they have, but it's kind of a charitable giving department where they're tasked with being responsible to the communities that they serve or that they reside in. And I'd say start there. Start there with the conversation, and that'll be a good starting point.
Great. And I see that we have a hand raised from Michael Hamilton. If you want to go ahead and unmute yourself and ask your question.
Hi, Michael Hamilton, and I just want to say to Donald and the organization that it's phenomenal what you guys are doing. I'm admiring you and your organization as I'm listening to this. So I want to, just say thank you for all you do. And I did have one question, and it's in regards to, I guess, the self-sufficiency aspect of your program. I was wondering if there's a specific curriculum you've introduced, and how is that self-sufficiency, statistic-wise, is it being recognized?
Yeah, great question, Michael. I think, and I'll give some info on this and then maybe pass it to Amita a little bit. But I think the idea that I came in with was around presenting opportunities to individuals, right? And so not just the hard tactical things, like, of course, folks need housing, folks need a job, and folks need those specific things to live, but it's the internal concept, right? And so the idea around feeling safe, being loved, being respected, feeling like you belong, right? How do we kind of build that foundation? Because, I've heard, and I think it's true, if folks have that foundation, 9 times out of 10, they're going to be okay. They'll be able to figure things out, right? They'll have a good emotional base to work from. And so what we do is we model that, and we create environments, and we create processes that engender that, right? Where folks are respected, where folks can feel that they're loved, where folks feel safe, and that folks feel like they belong. And we do that with a lot of different activities as well, right? Strength building activities, really focusing on what folks are good at, not what they're bad at, right? And really kind of getting them to a place where their level of confidence, they regain a level of confidence that they can start proceeding in life on their own terms, right? Like we don't dictate any of that. And I think from a self-sufficiency point of view, it's like, it's that walk towards self-actualization. And it's many steps, right? It's minor steps, right? But at the same time, when you achieve one thing, right, we celebrate that. We think ritual is extremely important in all of our lives, right? And ritual that many folks may not have had, that sort of praise and that sort of recognition, job well done, and I think the issue around, and I'm talking in terms of the principles that how we operate, and maybe Amita can kind of drill down on the specific curriculum of your question and kind of give you the overarching principles that we're about. I could talk about this all day long, and I know we don't have a finite amount of time, but Amita, if you want to chime in on a little bit on the curriculum, or if that's enough for you, Michael.
Mm-hmm. I can definitely try to give a brief overview. So I'm I guess just full transparency, I'm a licensed clinician. I live and breathe trauma, and I'm all about education and people understanding about trauma, what it looks like, how it shows up. So we've just we've invested a lot in making sure that all of our staff were trained in being trauma informed and gender responsive, because that is key to being able to provide services that are accessible and are less unsafe for people coming in our doors to access, right? And so the majority of our staff in reentry services are folks with lived experience. So this isn't something out of a book or something they've seen on TV. They've been part of the system. They understand how it impacts them, and as such, provide a lot of mentorship and role modeling for folks that we work with. So understanding how what incarceration trauma looks like, what historical trauma looks like, how that what trauma associated with grief and loss and community violence looks like, and then being able to work effectively with our folks that are coming in the door. And so we try to embody the principles of trauma-informed care. We work very hard to making our different sites welcoming, and we work very hard to make sure that we hold space for our clients so that they can feel seen and heard. And that goes a long way to building the relationship, because the key piece that I'm always, when I'm doing trainings and when I'm talking with staff around, is we need to remember that trauma happened in relationships. So healing has to happen in relationships. And sometimes we are the first relationship that somebody walking in that door can feel less unsafe with, or feel seen or heard or supported. And if we can bring that level into how we interact and how we provide our services, I think that's a huge part of helping people to heal and be able to move on and be successful with what it is that they're trying to do in their lives.
And then on a technical side, tactical side of it, we stipend a lot of our activities, right? So just in terms of giving folks money, right? Just that, that very tactical piece of it. We teach people how to make their beds. We give people hygiene kits, and we have those classes on hygiene. It's those tactical pieces of it as well that create that self-sufficiency model as well. I want to throw that in there.
If I can just share a quick example. Thank you, Donald. One of our ladies, so again, this assumption of what we've all been exposed to in terms of life skills and knowing how to do things. There was a young lady who I was just talking with one of our staff about. She would get ice and then she would chip away at it to break it up. And it never occurred to her that she could put ice in a blender, because no one had ever shown her how to do that. We have folks that are coming into apartment units that are not used to having stable housing, right? And that in and of itself is a huge thing that has to be addressed before you can have your own place. Everybody wants their own place or in share accommodation, but you may not be able to deal with that when it comes based on what you would have experienced. So there's a lot of, to that self-sufficiency piece, there's a lot of teaching and mentoring and education.
Great, thanks. I forgot to ask Michael, if you're willing to share what part of the state are you joining us from, and are you representing any particular agency?
I am associated with a few different nonprofits, but I'm formerly incarcerated. I did 30 years in prison, and I've been in the community now for 13 years. And I'm here today to learn and to hopefully give back as well. But I think, and again, I'm in Northern California. That was the question you asked, I believe. But no, I'm just very intrigued by, how lived experience is a huge part of everything we're talking about. Everything. So the peer provider, whole concept, it comes into play in every aspect here. So we're talking about, helping people to develop at every level. And my goal, I guess, and the people that we're working with are in mostly county jail. We were going into back into prison, but of course, we're still under the COVID mandate. So hopefully that changes soon. And we feel like, this form of transformation, this developmental process, we believe starts there, because the more informed any individual is before they get out, the better self-sufficient and self-sustained they can be. And so, so that's what we're doing now, and I appreciate you.
Absolutely. Well, we're so glad you're here with us today. Oops, muted myself. Adam Dietz has had their hand raised for a bit here. Adam, do you want to introduce yourself and ask your question?
I do, yeah. Hi, I'm Adam Dietz. I am a practitioner in the Bay Area, and I work with treatment courts in Oakland, Alameda County. And I raised a question in the chat, and I also wanted to voice it here verbally. And again, I want to thank everybody for being here. It's very great to be part of these conversations. I know there's a lot of talk in Los Angeles County about repurposing commercial property. And I am a resident of East Oakland and have long seen blighted commercial properties juxtaposed against homeless encampments, and it just infuriates me. And so I'm kind of curious for local leadership if they've looked at all at repurposing blighted property in the Bay Area and other locations.
Was that a question for Donald, Adam? or for the
Yeah, I think if either of you want to speak to that, that would be great.
I don't know. So Donald, in terms of repurposing blighted properties for housing, do we know where the county stands on that?
No, absolutely. Yeah, I think the question is really around the provider or the developer, right? So if there is, I'm sorry, are you talking about county or government property, or are you talking about just any blighted property that may be privately owned?
I'm not sure about ownership, but I am looking at commercial properties that I'm assuming they're zoned as commercial. If you just drive down, Foothill in East Oakland, like you'll just see all these properties that there's nothing happening. And then there's juxtapose that against encampments all over Oakland, all over Berkeley, San Francisco. It's just kind of jarring to see.
Yeah, there's a lot of conversation happening around that. And I think the collaboration between, for example, a provider, developer, and the government, which we have those conversations a lot, to really identify, how we can accommodate that. We were even looking at properties that were tax deferred properties that are just sitting there, right? That are basically government owned at the moment, right? How can we have those transferred over to a nonprofit so that we could then develop that, partner with the developer to develop housing on that as well? The same concept as what you're talking about, Adam. And there's a lot of conversation happening around that. And I think for folks to, financing is always the bear. I mean, if it's, to jump into one of these projects and then it's like, hey, how are we gonna make it work? How are we gonna finance it? But yeah, I think there is conversation happening around it, and it is doable and definitely possible.
Thank you, Adam.
That's great to hear. Thank you.
That is a really timely and important question. So I know if anybody wants to get in one last question, raise your hand or stick in the chat. Now is your chance. So our presenters need to head out in a few minutes, but in the meantime, this can be for either or both of you. If folks leaving the webinar today, just take away one key concept about no matter where you sit, whether it's in the justice system, the behavioral health system, anywhere else, how can I make a difference and spur more housing development in my community? What do you want people to take away from this today?
Can you repeat that, Charles? I'm sorry. Was that for me?
Sure. Yeah. It could be for either of you.
Oh.
So anybody on the webinar today, when they log off in half an hour, go back to their job and their community, what's the one thing they should remember if they want to be, part of the solution and spur more housing development in their community? What's the one principle they should take away from our conversation today?
Wow, just one?
Well, you can be a few.
So, I mean, here's I'll give you two sides of the issue. One side is around stigma and NIMBYism and with certain populations. So specifically around the criminal justice population and certain classifications of folks, right? So if someone, if their background and they've done their time and they had a murder case or 290, a sexual offense case or something to that effect, any kind of registered quote unquote offender, and to some degree, maybe not even at that level, right? I mean, just anyone with a justice involved background, it's pretty tough, right? In terms of renting, right? So that's one piece of it. And then in the community, if the community finds out that we're building this, because you have to have those community events when you're putting something in the neighborhood. And once they find out that, okay, criminal justice populations will be, accessing this, the neighborhood usually lose their mind, right? And so that NIMBYism is really huge. And I think, and in terms of how do we advocate for that, or advocate for housing for everyone, that everyone has a right to housing, and everyone has a right to live where their money would allow them to live, to kind of get that across in the bloodstream in the minds of the people. Then on the other side of it, from a policy perspective, there's a lot of restrictive policies with HUD, right? I mean, whether it's subsidies or living in a kind of government-sponsored housing development, there's some barriers and some challenges there as well. And then I think on a larger scale, and I'm talking about primarily barriers and collateral consequences, right, on the government side, that really impact our people, our folks who with criminal justice backgrounds in a negative way. And I say that to continue the fight on those issues, right? Now, in terms of housing, absolutely, write the governor, right, write your city council members, right, your board of supervisors, advocate for housing across the board. I think that those would be the messages that I would get, because a lot of this starts in a government department somewhere, right, or in a legislative body somewhere, right. So the folks that are making the laws, the folks that are now have to implement those laws, right? And then by the time it gets down to the mainstream, right, to the people in the community, it's really difficult to make things happen, and to make things happen right away. Even there's so many things you got to put together. And so I'll say stop after this. The average project takes several years, right? From the beginning of an idea to build to the completion of it. That's a long time, right? If you're talking about a construction project, renovation, a lot easier, right? But all of the permitting processes, all of this red tape that you go through, it's more than a notion. So I don't want to talk necessarily about the difficulties of things, but I don't want anybody to walk away from here thinking that this is a walk in the park either, right? And that there's a lot of advocacy that needs to be done on behalf of justice-involved human beings in order for them to lead a successful life when they're released.
And I'm sorry, I'm just going to jump in and say, Charles, I unfortunately have to jump off to take this task force call that we've got, but I just wanted to say thank you for the opportunity to share about what we're doing here. And Donald, I will leave it with you, but I look forward to catching the next one.
Okay, I think I can handle it, Amita. Take care.
All right, thank you so much.
Thank you so much, Amita.
Bye-bye.
No, I know you probably need to head out as well too in a moment.
No, I'm good. I'm good. I'll hang out with you guys. I'll hang out.
All right, we can take our one last question from Michael, who's got his hand raised here before we move on.
So, Mr. Frazier, you also, this negative aspect of the environments we are conditioned in, right? We're part of our, life experience lived in these environments. And one of the things that I feel like, has to be addressed immediately is the negative stigma around mental health. I mean, from everyone's aspect, from, convicted felons aspect, the trauma involved with all of, surviving members of violent crime, to officers, to military, to even athletes who share this same, negative stigma, because, you don't want someone next to you that's unpredictable out there, wherever you're at. And so again, what are we doing with the trauma? And so this negative stigma about mental health is a huge part in what we're trying to do, going back inside to encourage people to talk to someone.
I agree with you 100%, Michael.
Can I help answer that question, Don?
Oh yeah, go ahead, Ariane.
All right. Well, how's everybody doing? My name is Ariane Chapman. I'm the program coordinator down at BOSS, our Career Training and Employment Center. And Michael, just to address your question, man, what we are doing now, retraining our staff to be trauma-informed care servants and trauma-informed care case managers, so that we may be able to support our clients, support our participants in these issues that they are going through, especially with mental health and substance abuse. Right, so we are getting trained up, retrained on how to best support our clients, support our participants, and be able to refer them to other resources that will be able to help them additionally on top of the support that we are giving them. So that is one thing that we are focusing on right now to make sure that we are there supporting them with this housing epidemic and being there to support them with housing and employment.
Yeah. And we have a lot of peers in our program as well. And we probably 95% of our staff that work in our criminal justice programs have lived experience. And just to kind of tap that off, what you said earlier, Michael, about peers and peer support, we believe in it.
Thank you so much for sharing that. One of my favorite things about these webinars is we don't always get a chance to do this, but to exchange information about the great work people are doing around this issue throughout the state. So I know there's a request to put some of these links to these programs in the chat. So please, if we can do that, that would be great. I'm going to have to move on now, unfortunately, to the rest of our content. But if you have any further questions for us, the presenters, you can stick those in the chat. We'll make sure to get those to them. And thank you so much, Donald, for sharing just the depth of your experience and work in this area. I know I learned a lot.
Thank you for the invitation, and have a great day, everybody.
All right. So, given what we've heard today, the primer that we received, kind of several on the ground perspectives, I would love to share some more strategies and approaches with you all about when the rubber meets the road, how to put some strategies into place around funding and building partnerships to really move the needle on creating more housing. So next slide. So just to review, when you're trying to fund housing, and maybe this is a little bit more real now because we've heard about some real life examples, you're trying to fund capital, getting the housing built, operating, keeping it operating, and supportive services, which is really the glue that gets people into housing and keeps them housed. Us and some of our partners at the Corporation for Supportive Housing who've helped us with this content, we're going to look at this as a three-legged stool, and you have to have all three of those pieces of the stool in place for a housing project to be successful. So on the next slide, you'll see, so where do you go to get these different pieces of funding to prop up those legs of the stool? There are many, many different sources of funding out there. So there is funding for housing. The challenge is getting to the right tables, finding the right funding source, and making the case for your project. So I just wanted to give you a bit of a flavor here of some of the typical funding sources that are used in housing projects. In terms of capital, getting the housing built, by far the most common is what's called the low-income housing tax credit program. And I am definitely not an expert in this program, but long story short, what that is, if you don't know about it, is basically they are tax credits provided through the federal code that are sold back to investors and help raise money to develop housing on the private market, and has actually been the single largest source of affordable housing capital funding for decades now. And those are typically allocated through state housing finance agencies. So example, in California, CalHFA, the California Housing Finance Agency. Other typical capital funding sources include national and local housing trust funds, federal community development block grants, other conventional debt and loans. It's a long list. Operating funding is difficult to come by sometimes. Kind of what you hear sometimes around the development world is the gold standard is getting long-term Section 8 voucher assistance, particularly what's called a project-based voucher. So a voucher that stays with the physical unit permanently. Developers and underwriters love those because you have a consistent, guaranteed source of operating funding in perpetuity. But other sources of operating funding can be the federal home program. You can use proceeds from your developers' fees, other sources of funding from public housing authorities. Folks do tend to get creative. Sometimes there are also local programs for operating funding, and I'll get into that a little bit more. And then in terms of services, also a wide range of funding sources. One I really want to particularly point to is Medicaid. Another topic we're going to get to much more in detail in webinar 5, particularly with the launch of the CalAIM program and sort of bringing both traditional healthcare and non-traditional social determinants of health, including housing, under sort of a master care management framework. That is a huge opportunity to get more of these services funded and to help people leaving the justice system connect with housing. Next slide, please. So I also want to give you another example. This is actually from my hometown of Providence, Rhode Island. This is the Open Doors Project. It is 19 units of reentry housing for people who were formerly incarcerated. And it's a renovated ice cream factory. This actually kind of fits great with our earlier conversation about sort of reusing commercial properties. I live in the Northeast, and we see just a whole, we have properties like this everywhere that were once great and kind of sitting idle, and it's a great strategy to be able to repurpose these into housing. So this is a mixed use property, meaning there are both residential units as well as commercial units, and that kind of helps with sort of these operating funding gaps and keeping the building viable. But you'll see here, I think the thing I really want to point you to the most is that to get this property up and running and operational, and to keep it running, they had to pull together a variety of funding sources to prop up that three-legged stool. A number of capital sources, tax credits, home funds, more than one type of tax credit, actually. And then operating funds, you'll see here, it's a combination of Section 8 from the Providence Housing Authority, as well as what's called the Neighborhood Opportunity Fund. That's a Rhode Island state program that provides operating subsidy to developments. Operating funding, you need to be able to keep that going over the long term to keep a property affordable. So they had to pull together more than one source. And then finally, services are funded through a variety of sources as well, including from the developer fee. So just a quick example of kind of what it takes to identify a property, get it up and running, and keep it running to serve people in reentry. Next slide. And so I would be remiss if I didn't focus a bit on the American Rescue Plan Act. I'm sure everyone has heard of that. It is wide-ranging relief package to help states, localities deal with the long-term of financial and human effects of the COVID-19 pandemic. And it includes a number of funding sources for housing. And I just want to highlight a couple of them here for you. The Home ARP program. So the Home program is a HUD block grant fund formula funding program. So it goes to pots of the money go to states, counties, cities, depending on the size of the jurisdiction. HUD funds those by formula every year flexibly, and this money can be used for housing development, it can be used for services, it can be used for rental assistance. But HUD basically created another pot of the home money specifically for the ARP program. And that money has hit the street, I think it started last fall. And so cities, counties, and the states right now are developing their allocation plans. Basically, they're telling HUD what they propose to do with this money. And so it's really a great time to get to the table with these folks, see if the allocation plans are out now. If not, maybe you can have the conversation with the agency who's making that plan to really kind of make the case for prioritizing folks in reentry for some of these new funding resources. Next slide. Another key pot of ARP money is state and local fiscal recovery funds, which come from the Department of the Treasury. These are a much broader funding source. They can be used for many, many things besides housing, such as, public health uses, economic development, state and local revenue shortfalls, but you can specifically carve them out for housing uses and with similar flexibility as there is under the home ARP program. So a lot of cities and counties receive direct allocations from the government. A few California examples here, just so you can get a sense of what the amount of resources that we're dealing with, plus a large allocation to the state. And again, you really want to connect with, particularly with local governments around the uses of these funds. They're going to be spending them over the next couple of years. They have to be spent down by late 2024. So there is some opportunity to really influence these spending decisions because state and local governments are really free to kind of set their own priorities within a few broader priorities set by Treasury. Some places in California are already using them for housing. For example, incentives to landlords to rent to people in reentry, or providing matching funds, matching capital and operating funds to help make development projects more feasible. Next slide. And we're also at a moment here of historic state investments in housing. Many new programs launched, but the one I want to highlight right now, since we're running out of time a little bit, is Project Home Key. This was launched in 2020, as a result of the pandemic, and has been given a significant new funding boost in last year's state budget. And it's a combination of state and federal ARP funds that are used to pay for it. $2.75 billion over 2 years is what's budgeted. And applications are open right now until the end of May for about half of that. And so what Home Key does is it's designed to help communities acquire and rehab housing and get it online quickly. Because as Donald was mentioning earlier, housing development projects often take many years. It's complicated to get the funding in place, to get community approvals, to actually do the construction. So the idea behind Home Key is to take particularly hotels, but other properties as well, and really be able to more rapidly repurpose them and help meet our pretty severe affordable housing needs. So it's definitely a resource I want to highlight, and applications are still open, and it's really a great way to serve the needs of people with justice involvement. Next slide. And just, I'm so glad that this came up in our presentation. I won't have time to touch on this too much, but another critical part of development efforts is building community support. And also, building support in the community, kind of confronting opposition, and figuring out who your actual development partners are. So next slide. So who actually builds housing? When we talk about housing developers, we're actually talking about a whole wide range of different agencies. They might be for-profit developers. They may be like BOSS, a nonprofit housing developer. They may be a large national development corporation like Wind Development, or they may be a smaller community development corporation where their mission is to really just serve a certain area. And so how do we figure out who the developers are in our community who are building or interested in building affordable housing? It's not always straightforward, especially if you're in a smaller community. You kind of have to poke around in a few different places, but some things that you can do, I start by Googling things. What's been built in your area the last few years and who's building it? Maybe if you've built some if you're part of one of our prior webinars and took our advice about building stronger relationships with your housing providers, like the local continuum of care, they're going to really have their finger on the pulse of what development efforts are going on in your community. Also, State Housing Finance Agency will have a list of pipeline projects currently in the pipeline or ones that have been funded in the past few years. So it's good to kind of do your homework and kind of poke around to see who is doing this work as a first step to see who you might partner with. And really, the central strategy is to appeal to a common mission, particularly a mission-driven developer, maybe a CDC or a nonprofit that is already looking to build affordable housing, maybe serve folks who have experienced homelessness or with behavioral health needs. There is a real powerful case to be made here to focus on people in reentry. Next slide. But if you are not a housing developer or a houser, what can you bring to the table? Because it's important that when you're building these partnerships, we don't just come with our hands out. We do definitely need the housing resources, but we, no matter where we sit, whether it's within the criminal justice system, the behavioral health system, somewhere else, we have a lot to bring to the table. Under the COC program, under the low income housing tax credit program, there are bonus points to help get projects approved and more funding if you're serving people with justice involvement. Sometimes a developer might need, particularly if they're looking to build permanent supportive housing, say, you may have some existing relationships with service providers or referral networks. Maybe you're a local sheriff's department or another corrections agency that is really interested in helping keeping people from returning to your jail. So, in the long term, you may be interested in chipping in some short-term rental assistance, help with moving costs. Again, kind of thinking that spending a bit of money in the short term is going to save a lot of money in the long term by keeping people out of the system who really don't need to be there in the first place. And also, we have sort of more capital type resources, particularly like surplus land, which are also an important resource. Next slide. And again, we really hit on this in Boss's presentation, but we've got to look beyond just the typical housing developers. In addition to health plans, which are really kind of getting into this space lately, because housing is a social determinant of health. When people are stably housed, they use less health care, they have better health outcomes. So aside from it being the right thing to do, it also saves a lot of money to the healthcare system. So those can be some of the most readily available natural allies for you, but also faith-based groups, philanthropy, local banks. You might be surprised at who has a vested interest in helping to fund housing development. And again, mission alignment is key. One thing we always have been trying to drive home throughout this series is that people who've been involved with the justice system, they're not some separate population that we have to prioritize. There's a huge overlap with people experiencing homelessness, people with behavioral health needs. So many of these agencies and sectors, we really have a vested interest in helping create housing for people leaving prisons and jails. And another hook to get some of these other agencies involved is they may have regulatory requirements, such as the Community Reinvestment Act. We're getting involved in housing development helps them meet those requirements. Next slide. So again, to make the case for investment, making the financial case is often a centerpiece here. If you're not addressing homelessness for people who are cycling between, say, jails and emergency rooms and shelters, all of those systems are spending a lot of money. And in many cases, the amount of money that you would spend to keep somebody stably housed is much less. Where it gets difficult sometimes is that who is spending the money? If you are keeping somebody stably housed, you're probably saving money across multiple systems. But sometimes you need to make the case, say, to the healthcare system that investing in housing will save specifically healthcare costs. I keep dwelling on that one too, because I think that is really one of the most promising non-traditional development allies. And I think that's only going to increase in importance in the next several years. And, there are a lot of models out there that do this, including CSH's frequent user system engagement model. Thinking back to our second webinar and data, the more you can be sharing data across systems and identifying the people who keep coming into your jails and into your emergency rooms, you can really focus these housing efforts. And if you have really good data, you can actually really start tracking the cost savings at a more granular level. Next slide. All right, so real quick, because we're running out of time, we can't forget about building community support. A couple points that I want to drive home here is to plan ahead. Sometimes communities want to operate under the radar and kind of try to push a project through. That rarely works, and it usually ends up backfiring. Instead, what you want to be doing is thinking about natural allies in the community, maybe faith-based organizations, maybe folks you wouldn't think of, such as law enforcement. We talk to a lot of folks from law enforcement agencies who they really understand how important it is to get people housed and keep them from continued involvement in the justice system. So, bring your allies on board, figure out who you really want to tell the story, and find sort of a strategic way to get that out there in the community early and often. You're not going to change everybody's mind, and that's okay. You just need to really build a critical mass of support. And on the next slide, just a couple of messages that you can use for doing that is that you know who we are. You like our work. If you're someone who's been working in the community for many years, really focus on that trust and they understand that you're going to do the right thing. And some of these new housing developments, like the new permanent supportive housing development that Boss was talking about, it's a beautiful construction. These developments can really, modern affordable housing can be really beautiful and well done and well constructed and really add to the community. And it's going to have tremendous benefit for the people, not only people who might be coming from somewhere else, but people who are already living in our community. People who are leaving prisons and jails, they came from somewhere and they're members of our communities too. So all of these are just helpful messaging strategies that can help build community support. Next slide. All right, so just to finish up here, these 90 minutes always go by so fast. I wanted to share just a few key resources and some info on our final webinar in the series. So on the next slide, again, we'll be sending around a companion worksheet by email to this series. Some of the things that we talked about, particularly identifying development partners, identifying funding sources. We put together some questions that you can work through with others in your community to help identify some next steps. So hopefully it's a helpful tool for you. Next slide. A resource on our website, speaking of the American Rescue Plan Act, we have some breakdowns that we update regularly about kind of key takeaways, key funding sources that you should be looking at, not only with regard to housing, but with regard to education, workforce, and many other areas, and kind of strategies for how you can deploy that funding to meet your local needs. Next slide. And then a webinar that we did a couple of years ago, I also want to provide a link to, really just focus on community outreach and community communications strategies to help get community buy-in for housing. So yes, we will be sending out these slides to everybody who participated in this webinar, and that's a great resource if you want to dig into those strategies more specifically. Next slide. One thing, one back, please. One thing we really want to highlight, this was just released, a funding opportunity from the United States Department of Justice, Bureau of Justice Assistance. They're seeking applications from state government, local government, tribal governments. This is a real opportunity to kind of put more resources into housing development in a creative way. It's called the Pay for Success Initiative. Long story short, the Pay for Success approach is where investors provide capital to help get a project, it may be a housing project here. It may also be other reentry supportive services to help fund something, get it off the ground. And then government only repays that investment if certain outcomes are met, such as keeping people in housing, keeping people from returning to prison or jail, et cetera. It's an innovative mechanism to help create more resources for housing development while reducing the risk to government investors. So that solicitation is out now. Our agency is also the technical assistance provider for this. So if you get this grant, you'll get to work with us much more closely. But significant money is available, both a small planning grant and a much larger implementation grant. So if you're looking for resources to create more housing in a community, I highly encourage you to check this out. Next slide. And just a couple of final resources from our federal partners, one from HUD and one from the United States Interagency Council on Homelessness. If you want to learn more about those pesky operating funds and different sources that you can identify and leverage for your project, we have a really great review from HUD here. And then USICH has also recently put out some additional guidance on maximizing particularly American Rescue Plan funds, but also other federal funds to house people experiencing homelessness under the new federal House America initiative. So we definitely encourage you to check that out some more. Next slide. And then just some more information on Project Home Key applications. Time is definitely running out. We're in round 2 of funding. So we'll have the link here if you want to learn more and potentially think about submitting an application locally. And then finally, on the next slide, we're so sad to announce there's only one more session in this webinar series, so please make sure you attend if you can. We're going to have a great discussion on the role of rental assistance. So again, that operating funding and supportive services in helping people afford housing and stay housed. We're going to have some of our state partners from the Department of Healthcare Services talking much more in depth about the CalAIM program in particular and the exciting new opportunities to fund services and connections with housing. So I'm going to move to the final slide here. Definitely please subscribe to our newsletter. You have my email address here. If you have any follow-up questions, we would love to talk to you more about this topic. But thank you so much for participating today, for the lively discussion and conversation. And we hope to see you back with us for our last installment. Have a great afternoon, everybody.